for calling the VA Western New York Healthcare System at Batavia. If you are having a medical emergency, hang up now and dial 911. No emergency services are available at this facility.
Thank you for calling the Richard L. Rodebush VA Medical Center. If this is a life-threatening emergency, please hang up and dial 911.
Thank you for calling the Canandaigua VA Medical Center. If this is a medical emergency, please hang up and call 911 or go to your nearest emergency room.
Thank you for calling the Iowa City VA Medical Center, where we put veterans first. If this is a medical emergency, please hang up and dial 911.
The following medical alert is for all former active duty military personnel and their families. If you are a veteran with a life-threatening emergency, do not assume you will receive emergency treatment at a VA hospital. Not all VA hospitals offer 24-hour emergency services. I repeat, if you are in medical distress and in need of immediate emergency care, do not depend on a Department of Veterans Affairs hospital or medical center to provide you emergency treatment. Decades of budget cuts and reductions in medical staff have caused the Department of Veterans Affairs to reduce and even eliminate emergency care at many VA medical facilities nationwide. This action by the VA has resulted in critically ill veterans being denied emergency, life-saving treatment at VA hospitals, which has directly led to premature death. Emergency medical personnel and ambulance companies nationwide have been instructed not to transport emergency patients to VA hospitals under emergency condition. If you have a medical emergency, call 911 or go to your closest 24-hour full-care trauma hospital or medical center. This medical alert has been brought to you by Operation Firing for Effect, Campaign 2008, www.OFFE2008.org.
The time has come now for us as proud Americans to reevaluate, improve, and protect the health care system that services our veterans. The time has come for America to stand up for our troops.
On the road again with Willie Nelson. My message tonight, my friends, is that we're broadcasting this live to the troops overseas. This very special package as a gift. Thanks to Operation Fire for Effect, Veterans Connection, StardersRadio.com.
If you would, just from your heart, if you can tell the viewers how you feel about supporting full mandatory funding for veterans health care and ensuring that our young men and young women are cared for properly.
Well, I think we should expect nothing less from our country when we send our men and women over to fight a war. We have to take care of them when they get back. We have to take care of them while they're over there. And I think mandatory health funds is important because when a soldier comes back, he needs to know that he's going to get help if he needs it. And this is not where we're at today. The reason I got involved in this is because my friend Gene Symes called me and said, hey, here's what's going on, can you help? And Gene and I have talked about it for months now, I guess. And what can we do? And thanks to this gentleman here, a lot is being done. And I know all you folks are doing a lot also. But if it hadn't been for this guy, I wouldn't be involved because I wouldn't have known what was going on.
Thank you so much. On behalf of our organization, those kind words.
We have a good organization, and anything else I can do along the way, let me know.
Well,
the VA currently has a backlog of over 500,000 unprocessed disability claims. Many disabled veterans wait months for appointments and travel hundreds of miles for their medical care. Sick and injured veterans routinely arrive at VA hospital emergency rooms just to be told they're closed. Retired military families are facing dramatically higher costs and co-payments for their earned health care coverage. Every year, Congress bickers over the veterans' health care budget, and they routinely underestimated the funding needs of the VA. Full mandatory funding would take the politics out of this yearly budget process and would guarantee the health care funding needs of our veterans.
Operation Firing for Effect is a subsidiary of Veterans for Veteran Connection, Inc., a registered 501c3 nonprofit organization devoted to improving and protecting the services and entitlements earned by our men and women in uniform. Operation Firing for Effect is totally responsible for the content of this report. For more information, visit www.OFFE2008.org.
My name is Gene Symes, and I am the National Chairman of Operation Firing for Effect. The message that you just heard, the call for mandatory funding, I approve. God bless America.